Thank you, and good morning. So my story starts when I was about the same age as most of you here. I was at university at Nottingham, and I was fortunate to have been given a scholarship by the British High Commissioner. If you ever have a chance to study or to work or to live abroad, I would encourage you to do it for a period of time because it is a really enriching experience and it broadens your outlook and your approach. It was at medical school that I gained the inspiration to be a cardiothoracic surgeon. That is a surgeon who operates on the heart, the lungs, and the aorta. And it was largely due to this person here, Sir Magdi Yaqub, one of the legends in cardiothoracic surgery. And I had the opportunity to spend 6 weeks as an elective period with him to learn a bit more about the specialty. And he involved me in every single surgery he did, small little bits because I was only a medical student. But that influenced me and inspired me. It is so important when you're at your age to have a role model, a mentor to guide you and to look forward to for the successive years. And so important if you are a mentor that you try to inspire the next generation. So when I graduated and started working, I work in a range of hospitals, both small district hospitals, bigger general hospitals, and larger teaching hospitals and specialist hospitals, because I had to acquire the skills to be a surgeon, the basic skills, the technical skills, and the knowledge. And it is so useful also when you first graduate that you work in a variety of areas to find what interests you, where your niche is, and then you can focus on what you are really interested in. And that's important because if you are interested in what you're doing, if you have a passion for your work, then going to work every day becomes a joy, and you look forward to it every day. And for me, this was in cardiothoracic surgery. So I work in specialist centers in England, in London, and acquired the skills. And it's not just acquiring skills and knowledge and expertise, but also learning the processes, because the success of any surgery is not just dependent on the surgeon, but on the whole team, the anesthetists, the supporting staff, the nurses, the perfusionists, and also the setup at each center, the workflow, the quality control that goes with it. And all of this have to fit together. And this is where working in different organizations and centers can really help you have a good approach to your work. But of course, in surgery, the head of the team is the surgeon. And these are some of the surgeons whom I worked with and whom I acquired the skills from. And I owe a lot to each of these surgeons because you pick up various parts from each person. And it is so important that wherever you work, that you engage not just with your immediate supervisors, but with the very top in your organization, because you can learn so much from them. And it is so important that if you're at the very top of your organization, that you pass on your knowledge and your talents and your skills to everyone underneath you. So these are what I do now on a day-to-day basis: coronary bypass graft surgery, dealing with aneurysms and dissections of the aorta, valve repair and replacements, resection of lung cancer and other tumors of the chest, and also dealing with sweaty hands. It does seem a lot of things and a lot of skills to acquire, but remember that this took place over a long period of time. And you can see how many different experts in the field I had acquired this from. And this is where it's important that you build the foundations. And once you have got the foundations, then progressing further is quite easy. But we are talking about rising, and not just rising, but rising above. And in anything you do, it is important to rise above. So in surgery, it is important that we find new ways to treat new conditions. We find new approaches. We find more effective treatments. We find new indications for treatment. And more importantly, we ensure that the treatments we provide are effective and help improve the quality of life and the survival of patients. And to ensure this, we have to do research. We have to look at our results. We have to compare different treatments. We have to innovate. And when we do this, we have to publish. And this is so important. And this is how medicine and surgery is constantly advancing, because we look at what we do, we discover new things, we publish it, we compare it with existing treatments, and we let everyone know. Because if you just discover it and you keep it to yourself, then there's no progress. Only you yourselves will be providing that treatment. So you have to let everyone know so that others will also be able to learn from these new things. And they will progress this even further. And above all, work as a team. So you notice that each of these publications have a team, numerous authors and contributors to it. And each of these contributors have made a significant contribution to the work. If you ever have the opportunity to do a higher degree, wherever it may be, I would highly encourage it, because it is your chance to look into something in a lot more detail, to get a better understanding, and to discover new things in whatever area you are interested in. So I was privileged to do this at Imperial College, but you do need the resources to do it. And I was also fortunate to have been given an award by the health department in the UK. And I was interested in the mitral valve. This is the valve which separates the heart from the lungs. I was interested in how it works, how disease affects it, and how we can fix it, and whether it is beneficial to repair a diseased mitral valve. And I will tell you that this period of research was some of the most enjoyable period of my younger years. And to this day, I am still applying the insights I have gained on the mitral valve in my day-to-day clinical practice. So highly encourage you to do this if you have a chance to. And perhaps the best way to put everything you know on a particular subject together, all your knowledge, all your thoughts, all the work you have ever done, is to write a book on it. And the good thing about writing a book or editing a book is that you can invite contributions from all the other experts in this subject from all over the world, because people will have different views, they will have done their own work, and we can all learn from each other. And so you can put everything together in a textbook. And this is how we would learn and progress in our field. Now, you know you're doing something right when you receive an award from a prestigious organization. And I was honored to receive the Ontarian Professorship from the Royal College of Surgeons of England. In 2014. Now, in 2014, I was already back in Malaysia working in Sarawak at the Sarawak Heart Center. And I was the third person to have received the award from Malaysia. The first two received it 20 years earlier, and are very senior and established and now retired surgeons in the country. Yes, in 2012, I came back to Malaysia. And for those of you who are going abroad or are abroad studying or living or working, I would highly encourage you to come back to Malaysia when you're an expert. Yes, come back to the country when you're an expert in the field, because there's so much you can contribute to the country and your country does need your services. So our previous Director General of Health was the person responsible for bringing me back and making me aware of the need for heart surgeons in the country, the shortage of heart surgeons. And they had just opened this new heart center in Kuching, in Sarawak, the year before, and fully equipped it with state-of-the-art equipment. But there was only one surgeon. But there were two teams of anesthetists, perfusionists, cardiologists, and a very long waiting list for heart surgery. So when he told me all this, I said I had to come back. And you can see that when I came back, it even made the headlines in the local newspapers because they were so in need of this service. And these 4 years in Sarawak, in Kuching, is the most fulfilling period of my career because I could really tell that I was making a difference to the healthcare and the patients in the state of Sarawak in Borneo. But in whatever you do, it is important to rise and rise above, but also beyond. And that means doing more than what is expected of you. And what I noticed when I came back to Malaysia 12 years ago was that there was a wealth of clinical material in the country. And we had unique diseases which are different from that in other parts of the world. But there was an absence or lack of research going on. So we worked with the Ministry of Health to increase research capacity in the country. And with the Ministry of Health, we went around the country every 3 months to run research camps to what we call ignite the flame of research, because only by doing research can we progress. And so we reached out to all the doctors in these regions. They would come over a weekend, over a period of 3 days. We would look at their research ideas, and we would progress and improve it to a level where they could do some meaningful research, where we would get some answers to the clinical questions. And we could see the fruits of this research because soon we had to do writing workshops to get this, the outcomes of this research published in scientific journals. And we also started a national database on heart, lung, and chest surgery because we had to know the activity going on and we had to know the outcomes of the treatments we were providing. Whatever career you are in, it's important to work with everyone and to engage with the rest of your fraternity because it's important to progress your own organization, but it is even more important to ensure that your peers, your fraternity, sees eye to eye with you because only by working together can you achieve so much more at a higher level. And always accept any invitation to participate in an international or in a public event, whether it is speaking at a TED Talk like today, or another scientific meeting, or facilitating at a workshop, or being a judge at an event. Because by doing this, it is your opportunity to reach out to others, to spread your message, to spread your vision, and to share your knowledge with everyone. And if you can do that at the international level, rise up to it and accept the challenge. Because you bring it to the next level and you put a mark of your country on the world map. And I can tell you the interaction at international meetings is so different. You learn so much from what is being done elsewhere in other parts of the world. And others will learn from you as well in what you are doing in Malaysia. But while you're progressing all this, remember to pursue wherever you're working, your own organization. And so we continue to publish our local data, our local clinical situation. And that is very important. Rising above and beyond also means training the next generation. The reason why we are so short of cardiothoracic surgeons is because we had not been training. There was no structured training going on. And so there was no career pathway, and so no one went into the specialty. So we started a structured training in 2016, and we worked with the Royal College of Surgeons of Edinburgh so that we ensured the right standards were there, and we worked with the Ministry of Health. And as of the last few years, every year we are now producing 3 to 4 specialist heart chest surgeons. So we should meet the shortage of cardiothoracic surgeons in the country in the next 10 years. But if you meet any challenges, as you almost certainly will in whatever you're doing, don't run away from it, but address it head on and solve the problem. And if you can't solve the problem locally or by yourselves, go higher up. And sometimes this may have to involve the highest levels. And we had to change the Medical Act in Parliament to ensure the sustainability of specialist training in the country. The friendships, the relationships, your professional relationships you have developed, maintain them. So whenever I go abroad, I make an effort to visit my colleagues I've worked with previously in their centers where they're working, because I want to see what new things they're doing, what different things they're doing. And I want to bring this back to my practice as well. And if you can, invite them also to Malaysia and to visit you and to hold workshops, to hold meetings, because we also want to learn from them. And it is an opportunity to ensure that what we are doing here is benchmarked to what is done internationally. But above all, whatever you're doing, make sure that you're happy doing it. And make sure that you're working in a place where you're comfortable with, where the rest of your peers agree with you, have the same vision, have the same idea. So 6 years ago, I was invited to join this new heart hospital with the rest of the team there, and I accepted. I went there. It was a big challenge because it was a new hospital, but of course we are 6 years old now. And I tell you, the last 6 years has been some of the most enjoyable period of my working life, and I look forward to going to work every day. So my message to you, rise up, rise above, and rise above and beyond. Thank you very much. Thank you.